Hi, we're going to talk about what we mean when we talk about collapsed lungs. Collapsed lungs is sometimes a term that a lot of people use to talk about the way the lungs are deflated. So if you think about the lungs, you should think about a balloon, right? So the lungs fill with air when you breathe in, and then they deflate like a balloon when it's losing air when you're breathing out. But there's differences, right? So you can have the whole lung collapses, and that's usually related to some kind of trauma, but sometimes it can be related to other intrinsic chronic lung diseases that can cause an air leak depending on what's going on inside the lung. If the whole lung collapses, usually that signals a stressful event, right? Your patient or your child would be in distress. They can't breathe, they have chest pain, sometimes they can have bluish discoloration in their lips, in their face, they're pale. So when the whole lung collapses, it's an emergency. Sometimes when your doctor or a medical professional tells you where there is a collapse in the lung, they're not talking about the whole lung. They're talking about a part of the lung. The lung is divided into lobes, so it could be a lobe that collapsed, or it also could be a very small collapse of a part of that lobe. And that can mean that there's something obstructing the airways, such a mucus plug, or something like a foreign body in the airway, in the way, obstructing. And the treatment will depend really on what the problem is. If it's the whole lung collapse, we'll just have to address what is causing that collapse, whether it's an accumulation of air outside of the lung that is preventing the lung to expand, or an infection. And if there's small areas of collapse, we try to figure out what is causing the collapse and then treat that. So make sure you clarify and ask questions with your doctor to try to understand what are the best management strategies for your child.